All right. Hello, everybody, and welcome to today's session of blood-borne pathogens. This is our safety training where we're going to learn what blood-borne pathogens are, how we should best handle them, and what should we do. So we'll go ahead and get started. So on the agenda, we are going to talk about an introduction, OSHA standard, exposure control plan, and winter weather safety. So for blood-borne pathogens, basically this is going to help us potentially infectious bodily fluids fall underneath this. So this could be vomit, this could be blood, this could be just really any bodily fluid, such as urine. But most specifically, especially in housekeeping, we deal with blood. So this could be if somebody had an accident in one of the guest rooms, a guest had an accident, then our housekeeping has to come in behind them and clean it up. Maybe somebody got a little sickly and they vomited somewhere in the lobby or in one of the guest rooms. Also, we have to clean this up and we have to make sure that we're using the proper procedures. Maybe we find any kind of needles, like any kind of sharp objects that also could fall under this. So really, there's a lot of different things that can be covered under blood-borne pathogens. And the reason why we're talking about this is because we do have a standard from OSHA. There's OSHA 29 CFR 1910.1030. So that's a lot of numbers thrown at you, but what this really means is that we do have a standard from OSHA that is designed to protect employees from potential infectious bodily fluids. And this doesn't count just as a nosebleed. This is usually a larger amount of blood and more specific scenarios. So based off this standard, we're going to talk about who's covered by this. So a covered team member would be a team member with job duties such as housekeeping or engineering that could place them in contact with blood or potentially infectious materials. The people who wouldn't be covered is a Good Samaritan or more voluntary acts. So if you're assisting a coworker with a nosebleed, that would not be considered occupational exposure. It's important for everybody to learn about this because you never know what situation you're going to find yourself in, but especially those in roles that are very specific to this standard. It is a great way to pay attention and learn a lot. And if you have any questions at all, please talk to your chief engineer or your manager for more information. So for reasonably anticipated exposure, these are a few other people that would be involved. So this is outside of hospitality, but there's first responders. So first aid, medical care, medical waste handling, custodial services. Laundry workers are here in hospitality, so that's a big one for us. Biology laboratory faculty and staff, law enforcement personnel, firefighters, childcare, paramedics, and emergency medical technicians. So only one of those really applies to our staff greatly, but again, we have our own specific niche roles that will play a hand in this. So how exposure can occur? It can occur from a lot of different ways, but the first one being contact with the eyes, nose, mouth, or broken skin, needle sticks, or cuts from other contaminated sharps, such as broken glass. So if you're handling something, say you're handling a bloody towel, and then you immediately go ahead and you're itching your eye. So you're getting contact from your fingertip of your finger to the towel and then directly into your eye. That is basically contact immediately. And that can be very dangerous. That's why we always say make sure you're wearing gloves, wash your hands, make sure you're treating this as a biohazard because technically it can be considered a biohazard if we are not careful. So needle sticks, a big one to do is to watch out for under the beds for any kind of needle caps or needles. Luckily, it's not super common just to have needles lying around in guest rooms or public spaces, but there are stuff like insulin caps, maybe some temporary needles, but there's also a lot of other stuff like needles just from like sewing kits or anything else. Hopefully they don't have any blood on them, but you never know if you get pricked by a sharp object and you're not sure what it is. It's very important that we understand what to do next in the situation. So for us as OHM, we have an exposure control plan. It's a written plan and it is reviewed and updated annually. It is accessible to team members, so talk to your chief engineer if you would like to learn more about this. But really, our chief engineers and our executive housekeepers should have a good gauge on what to do in this exposure control. And so talking through them through conversation and doing departmental trainings is also an option if you're interested in that. But just make sure that you do know where this is located and who the right person you should go to if in case something ever happens. For the plan that we can talk about right now, we have exposure determination. So Jobs and tasks where exposure to bloodborne pathogens may occur. Again, that would be laundry, room attendants, engineers, anything like that. We would also have first responders and first aid. So, do we need to call an ambulance? Do we need to take them to the hospital? What is the severity of the situation? Is it someone else's blood? Is it your blood everywhere? We got to figure out what's going on. We also have laundry. When you're doing laundry in a lot of different sheets, you're pulling sheets from the basket into the washer and then into the dryer. Depending on the property, it might differ a little bit, but that's the general routine, is that you're taking sheets that were previously used and then washing them. And through there might be things hiding inside there, like someone might have bled on the sheets. There might be a needle in the sheets, anything that could stick you. So really, you just got to be careful as you're handling things, that if you notice something as a room attendant and you bring it down, make sure that your laundry team is aware of the situation with the specific part of linen. Or if you're in laundry and you don't have any awareness of something and you find something, make sure you're aware now and you're handling it effectively based on what you find. An exposure control plan will also include engineering and work practice controls. It'll have personal protective equipment. It'll talk about different types of training, and then also hepatitis B vaccinations, and it'll also have signs and labels. So now let's talk about what are bloodborne pathogens. So bloodborne pathogens are microorganisms in human blood that can cause disease. So for bloodborne pathogens, there's hepatitis B, which is HBV. You have hepatitis C, HCV, and human immunodeficiency virus, HIV. A lot of these you go by the acronym, so you've probably heard of HIV or HBV before, but those are 3 types that are good to know. So for hepatitis B, which is HBV, over 1.25 million Americans in the US are living with HBV infection. In 2018, 3,322 cases of acute hepatitis B were reported. The symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, and this may lead to chronic liver disease, liver cancer, and death. So it is very serious. There is a vaccination available, and HBV can survive 1 week in dried blood. Symptoms can occur 1 to 9 months after exposure. With all that information, you see why it is so important that we take this seriously and that we handle this the proper way. For hepatitis C, which is HCV, it is the most common chronic bloodborne infection in the US. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, and vomiting. May lead to chronic liver disease and death, and there is no preventative vaccine. Treatments can cure most people with HVC in 12 weeks. So, unfortunately, it is the same symptoms as the last one, which is HBV. But with that, it is still a disease that we do not want to have you as a team member have. We don't want anybody bringing that in. Luckily, it is not something that's like contracted just like a cold would be. But again, if you're not handling things properly that have needles or blood, we really need to make sure that we're up to date on our training. That way we don't have to worry about this for the next time. So next we have our human immunodeficiency virus. This is HIV. So this depletes the immune system and can lead to AIDS. It does not survive well outside the body, and there's no threat of contracting HIV through casual contact. So that means if you touch their arm or you touch their hand or you bump into them on accident, there's no threat of you contracting this. But some of the symptoms are sore throat, fever, night sweats, mouth ulcers, swollen lymph nodes, chills, rash, fatigue, and muscle aches. So this affects a lot more parts of the body than the previous 2. So there's other potentially infectious materials, what we call OPIM, bodily fluids contaminated with blood. So saliva, feces, vomit, urine, and skin tissue. There is a transmission potential. So if you contact with another person's blood or bodily fluid, there is a chance that you could get any of those bloodborne pathogens. So mucous membranes would be the eye, mouth, and nose. So if you touch something and then touch one of those membranes being on your face, that could be pretty bad. There's also non-intact skin. So if you have a cut or abrasion, and somehow that gets in there, that could also give you a bloodborne pathogen disease. We also have contaminated sharps, so again, needles and broken glass. So that is why it's important to be aware of your surroundings, because really you are protected as you are, but a lot of our tendency as humans is to then rub our eyes or rub our mouth or rub our nose. Or if we have any minor cuts just from on the duty or off duty, we come in with those cuts and we're not even going to be aware, because if they don't really hurt and they're not major, then we're probably not thinking about them. So it's always good to have PPE on, which is our preventative protective equipment, such as like gloves or aprons, anything like that, that we can use to help mitigate this. So for job duties with potential exposure, again, first aid, luckily we are not doctors, but we are using first aid on property in case there's any minor incidents. We do have incident cleanup. So again, if somebody went to the bathroom or they vomited somewhere they weren't supposed to, they maybe did it in the lobby or one of the guest rooms, we would have to clean that up. We also have janitorial staff in all the public spaces, and we also have our laundry attendants in the laundry room. And then if we're ever handling infectious waste, so really anybody is at risk, but these are going to be the main ways that you're going to be at risk. So controlling exposures with universal precautions. So we're going to treat all blood and other potentially infectious materials as infectious. You never know what is infected and what isn't, so it's always better to be safe than sorry. You have to have proper PPE use. Like I said, that is gloves, aprons, goggles, anything that you have on property to help you with this. Proper cleanup and decontamination. So we do have very specific cleaning procedures. In a lot of our guest rooms and spaces, we have some kind of universal cleaner that helps clean a little bit of bacteria, and it helps make things shiny and smell good. But overall, we usually use a lot stronger chemicals and things when it comes to biohazards. So in that scenario, if you're not already trained on that in your housekeeping team about what you should be using for that, please contact your executive housekeeper and we will go ahead and get you some proper training. We also have to make sure we're proper disposing of contaminated material. So if you have a bloody rag, of course, we don't want that mixed in with other stuff. Put that in its own bag and leave a note on it. That way, if laundry can wash it, they can wash it. But if it's something where maybe it's just some paper towels, but there's a lot of blood on there, anything like that, we just want to throw that away. So if we're going to throw it away, make sure you're bagging it with your gloves and any kind of other PPE you can use on your body, and then throwing that away and making sure that nobody else will be able to access that. So controlling exposures for engineering and work practice controls. So we do have sharps disposal containers. These are going to be red bins, as you can see in the picture. This one is a little miniature one, but we also have ones that look almost like gas tanks, or we have little boxes that are hanging on the wall. But we do have sharps disposal containers. So if you find something like a needle or maybe an insulin cap that has like the prongs in there, anything like that, we should probably be disposing of those most definitely in these bins. But if you do not have one in your department and you would like one due to the frequency of you finding these objects, request that from your chief engineer. But these should already be in every or almost every department, and you should have access to them no matter where you are. So if you are in the front desk and you don't have one, you can go to our engineering or housekeeping room, or if you're in sales, you can go to the front desk one. So as long as you have them where they are accessible no matter what part of the hotel or the facility that you're standing in. Also, hand hygiene is really important. So make sure you're washing your hands with hot water and soap. It is definitely a good thing to deep clean your own hands and arms after you handle this material. So just make sure that you are intentionally cleansing those hands. And that way you're not spreading anything without knowing it or touching your eyes and infecting yourself. So controlling exposures, again, this is back to personal protective equipment, which we've already kind of covered. But again, latex or nitrile gloves, which we have a lot in our food and beverage departments. We have some in housekeeping. Goggles, we have those for housekeeping and engineering. CPR mouth barriers, that should already be in the first aid kit. So if you're going to be giving somebody CPR, make sure you're grabbing one of the mouth barriers so you're not coming in contact. Aprons, and then respirators. Those are also usually within our engineering department, sometimes our housekeeping, depending on where they stock them. But these are just some examples that are really great to have on hand, both from a team member standpoint and a leadership standpoint. So next, we're going to make sure that we're always checking the PPE for defects or tears before using. So if you have gloves that are torn, are defective, remove them and replace them. Do never, ever handle a bloody object or anything that has vomit on it, any kind of bodily fluid that you're worried about with torn or bare hands. For this, you have to remove PPE before leaving a contaminated area as well, so you're not spreading it. So say that you had a glove on, your glove ripped, you have to take it off and remove it and make sure you throw it away. Then go ahead and grab a new glove, handle what needs to be handled. So put a bloody rag into a bag, take off the glove, put it in the trash, wash your hands really well, and then put a note on the bag and then take it where it needs to go and then wash your hands really well again. So do not reuse your gloves and do not reuse bags. The only thing that we technically use multiple times is a single sharps container. So one container can have many needles put in there, but once it's full, we are then going to dispose of that with our engineering team. So you will not be reusing the same sharps box. You're just putting multiple needles in there until it fills up, and then we're going to dispose of it. And we're going to make sure that we're also disposing things properly. So controlling exposures for housekeeping, we need to make sure we're keeping areas clean, we're using that protective equipment when needed, and we need to make sure we're not using our hands to pick up broken glass or handle sharp. So again, a great example for housekeeping is reaching under the bed. You never know what's down there. It's dark. There's different corners and crevices. So if you think you see something, make sure you shine a light on there and then use the right protective equipment to grab it. Or even if you do see it out in the open, don't use your bare hands. Always grab tongs or some kind of gloves that are thicker gloves. That way you won't cut through the glove and cut your skin. Make sure you have something on that'll help protect you. So cleanup and decontamination. When cleaning surfaces, wear protective gloves, use dilute bleach solutions or other suitable commercial disinfectant, do an initial wipe up, spray and allow it to stand for 10 minutes and then wipe up. Dispose of all wipes in a biohazard container. We also have biohazard bags that are red bags in a lot of our properties. So make sure that you use one of those if it's a biohazard you're cleaning up. And then all of your PPE is going to be disposed of in a biohazard container. Next, for controlling the exposures is hand washing. Wash hands immediately after removing PPE and use antibacterial soap. A hand sanitizer can be used, but wash with soap and water as soon as possible afterward. So soap and water is the key on this. Don't just trust yourself. Don't just trust hand sanitizer. Always make sure that you're somehow getting back to soap and water. For regulated medical waste, liquid or semi-liquid blood or other potentially infectious material, again, that's our OPIM, dispose in closable leak-proof red biohazard bags. This is the bags I mentioned earlier. We do have those available. And for contaminated sharps, dispose in sharps containers. So for signs and labels, labels must include the universal biohazard symbol, and the term biohazard must be attached to containers of regulated biohazard waste, refrigerators or freezers containing blood or opium, containers used to store, transport, or ship blood or opium. For an exposure incident, potentially infectious bodily fluid contact with mucous membranes or skin penetrations or openings. Report all incidents involving blood or bodily fluids, and post-exposure medical evaluations are offered. So if you get stuck with a needle on the job, then you are able to go to one of our facilities through our work comp carriers. Again, talk to your manager in the moment about that. They can help you, but what they can do is they can take you over there and get your blood tested to make sure that you don't have anything in your system. So if exposure occurs with eyes, nose, mouth, or open skin, immediately wash exposed areas with soap and water. Flush your nose, mouth, or skin with water, and then irrigate the eyes with water and saline. So we have a lot of eye wash stations that's required in our first aid kits. So if you have any eye wash in those first aid kits, or you have a station where it's one of the fountain stations where there's water that comes out of the fountain, use one of those, but definitely make sure you're washing things out. And then if the exposure occurs, report the exposure immediately to your shift lead and the manager on duty. The team member will be directed to the healthcare professional for medical evaluation and treatment. And with this, we have to make sure that we're following the proper protocol. So that's why it's so important that you communicate with your managers and the manager on duty at the time, because they can make sure that you are all good to go to go to that clinic. So post-exposure evaluation, we're going to have confidential medical evaluation and follow-up, and this is going to be a document route of exposure. So how did it happen? What did you touch? What do you think you touched after that? Identify the source individual. So was it a needle? Was it a rag? What did you touch? And also who touched this? So if you're the manager instead and you weren't the one directly involved, find out the details of this and make sure you're documenting this as well. Test sources individuals for blood with consent. So if you, as a team member, accidentally expose yourself to something and you're pretty sure that you got something in your eyes, nose, or mouth, or you got stuck with the needle, you are encouraged and you are more than welcome to work with our management team to go get treated and tested. But if you don't want to, you don't have to. We're not going to force you to, but just make sure you're communicating what you decide in that moment that it's happening. And with this, as a leadership standpoint, definitely encourage your team to go if they do, or yourself, make sure that you're going. But again, if you don't have consent, then we will just have to make sure we're documenting everything that we can and then carrying on as normal. So we're also going to provide results to an exposed employee. And this also goes back to incidents. So if you get stuck with a needle or something like this, it is good to tell your manager not only to get you treatment and to get you help, but also as a manager, we're going to have to log this as an incident report. So make sure that you're getting all this information, not only for the safety of your team, but also for the safety of your department and for our OSHA logs. So for hepatitis B vaccination, it's strongly endorsed by medical communities. It is offered to all potentially exposed employees through OHM, and it is no cost. And so for this, we're going to talk a little bit more. The vaccination is something that we set up with you through our corporate office. Our corporate HR team is really strong in making sure that everybody has the ability to get this vaccine. So on your ADP, you actually have a document section. If you've already signed off on it, you can see your form in there. But if you haven't signed off on this form yet, it's going to be under things to do in your ADP tab, where you can click on that and look at the hepatitis B vaccination form, where you can approve or deny us paying for you and scheduling your appointment to get a hepatitis B vaccination. We will schedule it for you, but of course we'll try to work with your schedule initially when we're trying to get this set up for you. But most recently, it's been 3 sessions at no cost to you, and it's through our corporate team, but you would still also talk to your manager. That way they can make sure that you're getting everything that you need. But if you decide not to, and you don't want to, that's okay. But if you do get stuck or you get infected on the job and you decide not to go, we just need to make sure that we have a declination form of treatment signed. That way we know that you don't want any treatment. Either way, we just want to know that you have the ability to go and that you don't have any further questions, because we want to make sure that you feel comfortable in the situation. So this is the form for questions. So if you have any questions at all, just go to your chief engineer, go to your executive housekeeper, come to your on-site property HR if you have one. But we're all here to help you. Go to your GM also if you have any concerns with your GM. This is something very important, and so that's why we're going over it in such depth. So if you have any questions, please reach out, or if you have anything to add or any extra ideas when it comes to keeping people safe from bloodborne pathogens, just let us know. Thank you, and have a great rest of your day.